If we had a plane crash every day where 120 people lost their lives, the federal government would be hitting the alarm button and doing everything possible to stop that from ever happening again. Last year, the CDC told us that on average, 115 Americans die every day from an opioid overdose. Overdoses from prescription opioids are a driving factor in the 16-year increase in overdose deaths, and the amount of prescription opioids sold to pharmacies, hospitals, and doctors' offices nearly quadrupled from 1999 to 2010. Yet there has been no related increase in the amount of pain that Americans reported. California emergency rooms treat one overdose every 45 minutes. California is listening, and we're doing something to help. Since joining the legislature 3 years ago, finding solutions to the opioid epidemic has been one of my top priorities. And so I'm pleased to join, and you've heard this word used several times, a number of my colleagues, in a bipartisan way to address an issue that has affected so many lives and so many families. As a healthcare provider and an assembly member who represents 2 counties in California, Humboldt and Mendocino, with an opioid prescription death rate that's 2 to 3 times the national average, I strongly believe we need to do more. And we must attack this crisis on many fronts: prevention, treatment, and by carefully controlling the prescribing process. I'm carrying 2 bills this year. AB 2760 requires for certain categories of high-risk patients, prescription for opioids must also include a co-prescription for naloxone. Now, naloxone is a medication designed to rapidly reverse opioid overdose. High-risk patients include those taking a higher dose of an opioid, those who are also on a benzodiazepine, which has sedative effects, and those patients who have previously had a history of substance abuse. Co-prescribing can also be an opportunity to initiate a discussion with patients on the risk of overdose, the stigma a patient may be facing, and broader issues around treatment for substance abuse. And for the people I represent on the North Coast who live many miles, many of them, from emergency services, this can literally be a lifesaver. Dr. Patrice Harris, chair of the AMA Opioid Task Force, has said, "We know that naloxone by itself will not reverse the nation's opioid epidemic, but it is a critical component that saves lives and gives a second chance." My other bill is AB 2789, which will require that prescriptions be submitted electronically. The intent of this legislation is threefold. 1, reduce doctor shopping and minimize the risk of altered, stolen, or fraudulent prescriptions. 2, to minimize prescription errors, and we know those happen. Doctors don't have the best of handwriting, and I can't tell you how many times I got a call from my pharmacy saying, "Doc, I just don't know what you wrote. Can you help me out?" And to facilitate placing information into the state's Cures database so that it's available to prescribers in a more timely fashion. I'm grateful for the bipartisan group of legislators here today to fight on behalf of Californians, both individuals, their families, and friends affected by the opioid crisis.